6:44 on your Monday morning. This is interesting. A new effort underway to keep marijuana users in our state safe. Last month, the Rocky Mountain Poison Center began partnering with the Department of Environmental Health for Marijuana Health and Safety Hotline. You can call in with questions or concerns. You can talk to a team of experts. We are joined here by Danica Lee, the Director of Public Health Inspections, to talk about what the hotline is designed for. Good to have you with us, first of all.
Thank you. Good to be here.
You know, in our state, obviously, we have unique challenges that some other states don't deal with. And we have support systems for questions about alcohol and questions about poison. We don't necessarily have phone lines that people can call with questions about marijuana. Is that the concept here?
Yeah, that's right. This is a health and safety hotline for issues relating to marijuana. It could be for marijuana users, parents of people who've consumed marijuana, but also for people who work in the industry who might have occupational health and safety concerns. So
almost a support system for those recreational marijuana stores as well, because they don't always have all the answers to all the questions that people come in and ask, right?
Yeah, absolutely. This hotline is not to provide advice about what types of strains might be most therapeutic or that type of thing, but it is.
There are plenty of experts out there for that, Danica.
That's what I hear.
So it's more for the medical side of it or the poison control side of it, and especially when you talk about families and parents, and if a kid somehow gets a hold of an edible, for example, that would be an issue that you guys could help out with.
Absolutely. That's what our trained medical call center staff are there to help with.
Well, and so much of this is uncharted territory. I mean, you can't go in and buy a training package for this and bring it to Denver. You sort of have to create the training package.
That's exactly right, although there certainly is, well-established medical expertise that supports this. But the investigations that have been done by the health department have uncovered concerns with pesticide contamination, concerns with, concentrated concentrates and some of the solvents that might be in there. So those could be health concerns as well.
So who do you see utilizing this phone line?
Well, we're hoping that we get, calls from anybody who has health concerns about products.
Yeah.
And then
there's no rules necessarily, right?
That's right. But also, obviously, those folks who are working in the industry, they may be working in a cultivation facility and think they might have been exposed to something. This would be a great resource to help establish a body of information that's really lacking in this industry.
And has the Poison Control Center fielded calls on these types of issues before?
Yes, they have, but this is kind of the first hotline of its kind where there's a dedicated, concerted effort here to establish a resource specifically for this.
All right, so let's give the number out. Let's talk about how people can get a hold of this new resource center. You've got it right here, 877-741-3777. And so this is a 24/7 deal. I mean, you guys have this phone line monitored all the time.
Yep, that's right. It is staffed 24/7.
And is it housed where the poison control staff is housed now?
Yep, it is.
Is this a natural extension? Do you think this is just an evolution of the marijuana industry here in Colorado?
Well, I think it's an important step towards, again, establishing that body of information that's really lacking here. We don't know what we don't know. And so the intent of this 3-month pilot is really to see, are we getting useful information, as well as we're hopefully providing a good resource for consumers and folks in the industry.
So it's a 3-month test. What happens after 3 months?
We'll evaluate what type of information we've gathered, the types of calls that we have gotten. If we're getting calls that really aren't related to the intent of the hotline, then that might cause us to reevaluate. And then there's also a funding piece. So we'll have to look at, the funding sources on this and see whether it has kind of proven its worth.
It's super interesting, and it could be very, very helpful for some folks, especially when you talk about workers and families and such. And we'll put the number online as well at kdvr.com if you want to write that down and just have it just in case. You never know. Thank you so much.
Yeah, thank you very much.
Pleasure to meet you. Thanks for coming and talking about that. Let's go over to Greg now. He's watching your weather and going to